So this lecture covers loads and loads of stuff: acids, bases, foreign bodies, magnets, batteries, like I say, everything that's under the kitchen sink or the kitchen drawer kind of thing. Start out with caustics. We'll start out with some data actually. Um, So this is a few years old, but typical pie chart of what we know. We see who calls us. Mostly young children and even older children make up almost half of our calls, and they get into things that they have access to, which is household products around the house. Here's the breakdown. I'm not going to reread these, but you see there's a lot of household cleaning products and cosmetic products and toys and foreign bodies that sort of populate the younger children's access to things. And so that's what we're going to focus on this lecture. And I think they like asking lots of little questions about this. There used to be some consistency about warning labels based on the Federal Hazardous Substance Act. I use these three words: danger, warning, and caution, although they tend to get mixed a little bit. There actually is to be milligram per kilogram definitions of how concentrated the product had to be before you give them one of these. I don't think anyone follows those anymore. The bottom line is the two lower ones, caution and warning, are mostly irritants and aren't less likely to be lethal in any dose, especially toddler ingestions, whereas danger have higher toxicities. They're either corrosives, acid bases, or flammable substances. So, a little bit about acids and bases. pH neutral is 7.0. Some people would say up to 7.5. This number is the inverse log. The pH is inverse log of the concentration of hydrogen ions. So acids lose protons and they have pHs that are low because the hydrogen ion concentration is lower. And bases accept or gain protons and the pH is high. What do we really consider strong acids and bases if we're going to actually measure them or ask someone to look at the product label? It's usually at the really far ends of the spectrum, like pHs of 1, 2, maybe even up to 3, and strong bases all the way up to high end of 12 and higher. Although most of this is driven by symptoms more so than how bad the product was. I think it's reassuring if I get a product and pH is 8 or it's 6 and they're not having any symptoms. I feel pretty good about not sending them in or just having them rinse out their mouth. When they do get in, it really doesn't make any sense to check the pH of their saliva. Sometimes we check pHs of tears if they get this in their eyes, but you got to make sure you use the right pH paper. You can see the one on the right there only goes between 4 and 9, so it's going to miss the strong acids and bases, whereas the one on the lower end, has a little bit wider. People will buy different products depending on what's available. A lot of times we use the ones that are in the cart, and those are mostly just in the middle. So a couple of buzzwords that they like to bring up. So alkalis or alkaline bases create liquefaction necrosis. If you think about it, these were used to make soaps or saponify the fatty acids in membranes, and they penetrate deeper, making these membranes very soapy, oozy, weepy, and it keeps going because it's not going to stop anywhere. They have a soapy appearance, and the stronger the alkali, usually hydroxy groups, they're stronger, they are likely to cause this liquefactive necrosis. The acids, however, were used in tanning, if you want to remember sort of the early, turn of the century, pre-turn of the century uses for these. So it creates a coagulum. It stops penetrating deeply and causes a leathery hide like a tanning thing. So they have a coagulative necrosis. And they like throwing those terms around and seeing if you remember the association with those. Let's talk about a few things around the house. A lot of alkalis. Some of these have disappeared over time because they were really toxic. In fact, the very first poison center in Chicago got started because of the number of children getting into oven cleaners that contained sodium or potassium hydroxide. And Edward Press, the original poison center director for Chicago, essentially put together a bunch of index cards in his office of what was in different products, and that's who people called. They got to find his number to his office, and someone would answer and flip through the cards, and they say, what's in Drano or what's in Easy Off, and he would have the actual concentrations. That was sort of the first harbinger of the poison centers getting started. Now we have everything's database, but that's how it was way back when. There are other things besides that. There's drain cleaners and oven cleaners and cement cleaners and detergents. So all in all, you all know you have to look up the exact product. Products change over time. Names, sometimes a product company will have 7 or 8 products out there, so you have to get the specific name. So the bad ones were oven cleaners, which are hydroxide, and drain openers, which are often also hydroxide. They all had high pHs above that threshold of 12, and they all cause this ulcerative, liquefactive necrosis. If they got down to the stomach, they can cause GI ulcerations. If there was burns in the mouth, they may salivate. They certainly almost always had trouble swallowing. And so that's kind of our triage test. If someone got a sip of something, sometimes a parent can't look in the back of their mouth, but if you give them a sip of something neutral like water, um, and they're able to take it, or a popsicle or an icy, and they're able to take it without grimacing, which is the key thing, is does they make a face when they swallow? Then it hurts because they may not tell you that it hurts. Standard old-fashioned household bleach is usually hypochlorite, and it's usually not alkaline enough to cause GI effects. Unfortunately, they've made these super oxy charged bleaches, and getting enough of these sometimes are. So I would exclude all these super powered oxy charged bleaches from it's probably going to be okay category and go back to the can they swallow test at home. If they can't, or they're making a face, it should be triaged in to be evaluated further. Hopefully, a physician maybe take a look in the back of their mouth. Bleach is basically the normal is less than 5% sodium hypochlorite. This is also what we use in Dankin solution, which is like a wound care solution sometimes for ulcerated skin. Like I said, the OxyCleans have all sorts of other things in it, like oxalic acids. So you have an acid and a base, so it may be neutral, but sometimes, they're super strength bleaches. This is a favorite test for some question for some reason of what gas you get when you mix different household cleaners. So if you mix ammonia or ammoniums with bleach, like household ammonia with regular bleach, you get chloramine for ammonia. But if you mix a regular acid with bleach, I'm not sure oxalic acid is strong enough, you can get chlorine gas liberated. Household acids are many. There are probably fewer of these that are actually in widespread use, but toilet bowl cleaners can contain phosphoric acid, not the strongest acid out there, but definitely can cause problems if someone drank intentionally a large amount. Other drain cleaners, metal cleaners, and rust removers, we like to think and worry about hydrofluoric acid, which we will mention again, but we mentioned the other day pool cleaners and sort of certainly automotive battery fluids. Now, a lot of batteries are sealed and we don't have that many problems with that anymore. So let's talk about 2 or 3 acids and alkalis. So hydrochloric acid, bleaching agents are usually less than 10%. Concentrates can be as high as 36%. Local burns are probably significant problems. Systemic absorption is usually minimal because as an acid, it causes a coagulation and they don't get absorbed. Sulfuric acid, like in an old battery or someone gets sprayed in the face with this, more likely than they drank this, is a high concentration. There are some fuming sulfuric acids for industrial drain cleaners that you have to be aware of. This is all, I mean, dilution is the main treatment for these. And if they have GI issues, that'll need to be scoped. Acetic acid is usually generally safe if it's a vinegar type of thing. That's usually not strong enough. However, there's glacial acetic acid used in industrial processes like manufacturing, rayon and hats and laundry and textile industries. These can be pretty irritating and actually desiccating, and at higher concentrations can actually produce burns. You may get a little bit of systemic absorption with this and get hemolysis and hepatorenal toxicity as well. That's only with the super high strength glacial acetic acid exposures. So what do? We look in their mouth, and if there's pain, or they can't drink water, or they're drooling, or there's ulcerations or edema, then we want to make sure their airway is established. So if there's a risk of them losing their airway, they may need to be intubated. Doesn't happen that often, but sometimes we can decide to get them rinse out their mouth with water if they can. It's okay to have them swallow and wash whatever's in their esophagus down at their stomach. But the standard of care has always been they should have emergent endoscopy within 24 hours. And so why? What am I going to do? What do I find? There's sort of a growing body of literature. It's not huge, that if there's type 2 burns or lesions that are circumferential, meaning all the way around the esophagus, giving IV steroids for anywhere from 1 to 3 days may prevent the formation of strictures, which may require the placement of a feeding tube or may require dilation, surgically later down the line. So if we can prevent that, that's great for long-term complications. The big caution is it's okay if someone has lower levels of graded burns and they get steroids, but you don't want to give steroids to someone who has a class 3 full thickness burn anywhere in their esophagus. So if you can differentiate who's got the 3rd degree from the 2nd degree burns, that's sort of the cutoff for who will get or won't get steroids. So here's the classification by endoscopy. It's called a Zargar classification. I don't think they'll ask you what that is, but 2A is superficial with blisters, and 2B is circumferential, meaning all the way around in a circle with ulcerations. Some people make a difference between 3A and 3B, but a lot of these are just grouped together. These are deep, full thickness burns. Here is one of the studies of methylprednisolone, one of the steroids, and shows you that the risk with 2B things is lower for delayed esophageal findings than the ones who got the control. So these were, number of these were like 26, trying to see what the percentage of ones were on this slide, 53% versus 68%. I'm sure this is listed backwards, so I'm sorry. The other thing comes up is a lot of times like either that somebody doesn't want to come in and scope them at all, or there's a child and there's no pediatric endoscopy GI person nearby, and we got to transfer them all the way up to Dornbecker or Randall. So I think unfortunately I would vote against using the contrast enhanced thoracic CT in children just because of the radiation exposure. I think pretty much all the children, first of all, it hasn't been studied very well in children, and second, there's a risk of radiation because it's a pretty high dose of REMS that you have to do it. And the adults who can't be transferred, I mean, you can rule out perforation and you can rule out mediastinitis with the thoracic CT probably easily. It's hard to grade whether they have 1st or 2nd degree lesions on it. You probably would see a 3rd degree lesion. So you wouldn't know if they needed steroids, but you probably would understand if they were sick enough to not get steroids and need longer hospitalization. So although people have suggested this, I still think it's not quite ready for super prime time use. Here's the CT grading score. It doesn't correlate exactly with the Zagar endoscopy score, but grade 2 is wall edema and surrounding tissue, and grade 3 is transmural necrosis, which is a full thickness. Grade 3 equals grade 3. The in-between findings in CT kind of range through several grades, so it's not that helpful. Here's some pictures. It's hard to see. It depends how big your computer is, but those arrows show blips in the esophagus. This one shows like a little bubble. This is a bigger bubble. That'll show what's in there. This one grade, arrow D, is a grade 4 edematous wall thickening with a small infiltration, like a perforation back here. So this fluid outside of the esophagus. This is sort of an algorithm proposed by someone. It's basically you can do the CT. If it's completely normal, you're done, maybe. If it's not, then you still need to probably scope them if they're still symptomatic. So let's talk about some special caustics that are out there. We talked about hydrofluoric acid yesterday, so I'm not going to belabor it that much. It's used as a wheel cleaner and a metal parts cleaner and a rust remover. It's also coming into increased use with solar panel cleaning as well. There are different concentrations. There's sort of a home concentration, a hobbyist concentration of aqueous HF of 3%. But I mentioned yesterday the ammonium bifluoride is usually a household use, but it's got twice the fluoride. So at 10% ammonium bifluoride, it's really equivalent to a 20% HF, and that's a pretty scary concentration to use. The industrial strength ones are usually painful immediately, and they can vaporize and cause inhalation burns. And we mentioned their biggest risk is not so much that they create a dramatic blistering burn, but they bind with calcium and magnesium, causing electrolyte depletion and arrhythmias. And later, as cell death happens, they release potassium, enhancing the arrhythmogenic potential. People who drink this, not so much to get it on their fingers, but drink this, usually die between 6 and 12 hours after ingestion from an arrhythmia, not from esophageal injury or a burn. And we showed you some pictures of what they look like yesterday. I think these are the same pictures. We can use calcium, of course. Again, they like testing the difference between calcium gluconate, calcium chloride. There's 3 times as much calcium in the smaller molecule, which is calcium chloride. A gram of that has 13 milliequivalents versus calcium gluconate. A gram of that has only 4.6 milliequivalents of available calcium. So we talked about the beer block that some people would use. What do you do if there's a chemical in the eye? Irrigate, irrigate, irrigate if they can get to a shower or a sink or someone even just taking a glass or a pitcher of water and pouring it over their eyes while they're blinking rapidly to kind of get at all corners of their eyes. That's sort of the main thing. Not a fan of these, the Morgan lenses. Every ER seems to love these because it's like a plug it and leave it thing. But if there's erosions on the surface of the eye, they can actually perhaps increase damage. If it's just they got some irritating substance in their eye or a mist blew into their eyes while they were working somewhere, I think these are probably okay. Another notoriously bad acid is the acid of the metal selenium, which is selenious acid. It's used in gun bluing. I'm not a gun owner or ever had one, but basically it's, I guess you polish the metal so it has that gleaming silvery blue color to it, and this is the product that makes it do that. Unfortunately, drinking even small amounts of selenious acid, even in the accidental toddler ingestion, can produce a multi-organ system failure injury with a cardiomyopathy, acute pulmonary edema, and caustic injury of the esophagus and GI tract. And unfortunately, it's almost universally fatal if it's more than just like a taste or a lick. Any sort of gulp is usually enough to cause this problem. You have to get them transferred immediately to a pediatric critical care tertiary center and let them do the full supportive care for intubation and vascular agents and even I guess ECMO in nowadays would be a possibility for some of these folks. I don't think we've had one of these in the ECMO era, but it certainly wouldn't rule out considering ECMO if somebody was sick enough from drinking this. Super glue is another thing around the house. It's an acrylic glue. I don't know why people mix this up with their eye drops, but they do. It's not particularly damaging to the eye. It's going to be pretty irritating and distressing because they can't open the eye. Really, the only answer is to kind of slowly wait for it to harden and just kind of pick it off in little pieces gently. In the hospital, maybe they can use a fine tweezer to pick it out very carefully from the eyelashes. But it takes a great deal of patience and time to get that done. And then a lubricating eye lube afterwards is probably all that they need. There's a child with some glue in his eye. So warm cloth, peel off the pieces. People have used an 11 blade if they're adept at using a blade, but a fine tweezers is fine. Don't use any of these other solvents like acetones or alcohols in the eye. It's just patience and slowly picking away at the plasticized glue solution. All right, changing gears a tiny bit to disinfectants and antiseptics. Um, I like this joke. Two men walked in a bar. One ordered H2O. The other says, I'll have H2O too. And he died. Because peroxide is H2O. This is used as a cleaning agent, as a wound cleaning agent, but in industrial strength, um, hydrogen peroxide or food grade hydrogen peroxide is 35% hydrogen peroxide. It will mix with the hydrochloric acid in your stomach to liberate enormous amounts of free oxygen, which isn't dangerous, but the rate of oxygen liberation and the distension of the stomach creates an ability for the oxygen to diapedese, essentially go through the small cracks in the stomach wall into the portal circulation, where it then travels to the liver and gets stuck in the portal venous vessels, and it can easily be seen on CT. And we still think, I think, that it should be treated if there's substantial gas with hyperbaric. I know the number of hyperbaric places are disappearing, so I don't have a good answer for what to do when they're gone. This is maybe a subtle one, a peroxide gas embolism with lots of little dots everywhere. I might say try a period of time where they can be watched to make sure that they're disappearing over 12 hours, but be prepared to take them to a dive if they develop any neurologic symptoms. This is oh my gosh, kind of this, thing is like there's gas everywhere. This is not going to go away without hyperbaric oxygen. They need to go to a chamber. All these gas that are outlining all the portal venous vessels probably need to be repressurized, make the gas shrink, the oxygen shrink, and so there's no risk of embolism beyond the liver to the heart or the brain, creating a stroke, pulmonary embolism even, or a um, cardiac event. The risk of that happening, if you look at the complete MPDS database for the country, is about, if you find gas on a scan, it's about 8% will go on to embolize systemically. So that's not sort of a roll the dice kind of number. That's kind of a probably want to do something about it kind of number. Another antiseptic, potassium permanganate. There are certain cultures that love this, sort of like um, Eastern Mediterranean, Russian, Greek. Seems to be a very pervasive household product where they use potassium permanganate to wash things off with and sterilize it. It's purple, so you can see what it looks like. Sometimes it comes as a powder. It's really not an acid or a base. It's just a strong oxidizer. And strong oxidizers are able to cause caustic injury to the esophagus. It's actually metabolized to manganese hydroxide, so which is a strong base. So mostly it's dilute and observe if they can't swallow. It's the same rules for endoscopy as we have for other things that are caustics. So not all caustics are acids or bases. Some of them are oxidizers. This is the one that's the oxidizer. Iodine and iodide are different. We don't see very much of it anymore, but it makes it ripe for making a question about which, if you drank one or the other, which one do you worry about? So iodide with the D is non-toxic. You can convert iodine if they swallow tincture of iodine, which is a mixture of alcohol and iodine, as an antiseptic to iodide, which is non-toxic, by mixing it with starch or flour. You can literally have someone go down to the hospital kitchen and send up a cup of flour, mix it up in a slurry of water, and have them drink it. And usually it turns the vomit brownish, purplish color with the iodide in it, but the iodide is not tissue toxic. Otherwise, it's oh, there's a question in there. Oh, I can't read it while I get my slides open. I'll get back to it, the question later. Um, so you can, basically, um, this purple brown is kind of a clue whether you're dealing with iodine or just iodide already. Here is now the iodophores are not a problem. This is betadine. We have this all over the hospital and the ER to wash up wounds and stuff. It's povidone iodine, and even though it's iodine, it's in a form that's not toxic. There's only 1% available as iodine and 0.001% as the free iodine. So not a lot to cause tissue injury. Only toxic if you, I guess, drank a full bottle of this. They could develop acidosis and acute kidney injury. So I guess in those rare occasions where someone, for whatever self-harm reasons, drank an entire bottle of betadine, it would follow renal functions, pHs, anion gap, and if they develop renal insufficiency, CRRT may be an option for them. So summary, iodide, not corrosive, iodine, possibly toxic. The iodide is an anion. The triiodine anion is -3. It's used in other compounds that may have associated toxicity, such as arsenic and antimony. They're the real problems if you have something like that, rather than the iodide. Whereas elemental iodine, as long as it's not in betadine, is the one that we worry about. Let me see if I can look at what those questions are popping up. I gotta shrink this down for a second to look at those. So the consult and iodine misuse exposure a few weeks ago. Yeah, okay. Do you have info about how much oxygen is created per volume of H2O2? Yeah. For those of you who remember Mike Mullins, one of our fellows from the 90s, he did a paper, and I think you can liberate upwards of 12 to 14 liters of oxygen with 2 gulps of 35% food grade hydrogen peroxide. So it can be very substantial, deceptively large. Boric acid is a roach powder. You can see it right there. It's boron with 3 hydroxy groups on it. Or it could be an eye wash. There's a lot of eye wash which it says inactive ingredient boric acid, except the amount is, like Paracelsus says, the dose is either therapeutic or toxic. In the original boric acids you can buy over the counter, the triad is usually blue, green vomit is boiled lobster skin, so green vomit, red skin, and renal failure. So it's supportive, rehydration. Most accidental ingestions do fine. It used to be a very common cleaning agent, and an eye wash is still available over the counter. Renal failure, sometimes the redness goes on to desquaminate. They may present late in renal failure with desquamation. You should ask about what they may have eaten accidentally. Disinfectants, most of these are of lower toxicity. There's a couple of notorious ones that are oil-based and have a higher risk of aspiration. So all the original formulations of pine oil or pine sol, I don't think they're going to give you an actual brand name, but they may say pine oil-based cleaning compound, are very high aspiration risk, especially in children, for both GI symptoms, and then once they aspirate, they may have CNS symptoms as well. Again, treatment is supportive. They often like making a kind of a issue splitting detergents into anionic, cationic, and non-ionic. It probably doesn't matter if it's take enough of it and it's irritating or it's mixed with other things like perborates and other cleaners. If it's irritating, I think we have to treat them like all esophageal injuries and deal with them accordingly. If you look up a product at home and the kid's able to take sips of liquid and you find out it's an anionic detergent with surfactants, um, it's mostly negatively charged, and it's these soaps like lauryl sulfate that's in shampoos and other things, and they're just slightly irritating, not likely to cause a burn. It's the cationics that have ammonium ions in it, and some of them even have benzalkonium chloride in it, and these are the more caustic ones. So cationic caustic, if you can remember the C's together, that's probably a good way to link those two together. Laundry pods, when they came on the market, were pretty notorious for we were sending them all in. I think a couple of things happened where we can maybe take a step back from that. First of all, there was greater recognition by both the companies, poison centers, and the general public that these were a problem. So they had these more hard to open containers where you really needed big hands to open up that container. So a 2-year-old probably wouldn't do it, but it doesn't mean that these pods wouldn't get left laying around. They also strengthened the membrane around the individual colored contents of the pods. They used to be very thin, so they would just immediately break open when you threw them in the washing machine. And that's exactly what happened when kids put them in their mouth because they look like candy. They kind of broke open, exploded often backwards down the back of their throat, and saturated their vocal cords and larynx with this caustic irritating injury. And they had laryngospasm, and some of them lost their airways, and some of them got hypoxic and got unconscious. We still see those. So I think if someone put a pod in their mouth, whether it's an adult who was following one of those challenges online or a child who picked one up because it looked kind of colorful, if they had immediate symptoms, I think they should go in and be evaluated to see the extent of at least upper airway injury, and if they have trouble swallowing, perhaps endoscopy. If they're fine and they spit it out and they're drinking water and they're not choking, gagging, or sputtering in the background, they potentially could be watched and called back in a half hour to an hour to see how they're doing before the decision to send them to the hospital needs to be made. You can see they were like a fad for a while in the early 20 teens, and then they kind of fell off. I think 2015 was an incomplete year, but you can see by 2018 it was starting to fall off in numbers. Soaps and shampoos are generally low toxicity. If you drink a lot of them, you're going to get diarrhea, sort of an osmotic diarrhea. Again, the cationic substances can be a little bit more problem. Sometimes they're found for unique uses like swimming pool cleaners and stuff like that, and those tend to be more caustic. The anionic and most of them, are usually unlikely to cause problems. I keep seeing references to it may cause hemolysis, but I've never ever heard of a case, quite frankly. But I guess they could ask that on a test. Hair products, and generally the really old bad ones are not on the market. A couple of notations though. Hair straighteners sometimes contain sodium. Could you try again? Oops, my Siri, you're listening to me. Um, so hair straighteners sometimes contain sodium hydroxide. Of course, if you drink a bottle of that, it can cause alkaline burn. So the usual approach to these is can they swallow? Hair wave products can contain potassium bromates. And the notorious thing about this is the bromates, which is different than bromide, because it's oxidated bromides, can cause deafness, CNS depression, and renal failure through glomerular sclerosis. So I guess if they drank these, I might send them in to get them NG tubed out, but there's not very many of these around anymore. Most of the hair colorants are just oxidizes. They're a little caustic. They have low levels of hydrogen peroxide, but once again, you have to read the bottle to see what the final strength is. Some of them are concentrates, I guess, and they could lead to problems. There's a tiny bit of lead in the product called Just for Men to get the gray out, but it's not enough to cause lead poisoning acutely, even if you drank a whole bottle. The Brazilian wave, which was popular a few years ago, maybe still can get it, has formaldehyde in it. That's a long-term cancer risk, but as far as short-term injury, it's probably more irritating and desiccating than truly causing esophageal injury. One thing that we have seen that is a problem, and this is from our actual case that Matt Correa published, is henna, true henna, not fake henna, in black hair dyes. It has the compound paraphenylene diamine, and it can cause both angioedema. I think you see this person's face is really swollen, and her forehead, right around where the hair bleed dye was, is really, really swollen. And she also had substantial methemoglobinemia, which is the other thing that this PPT can do. So if henna is the agent, and their pulse ox is 85%, think methemoglobinemia. Products for nail polishes are often just solvents. Some of them have acetone, some of them have xylene. There's a risk of aspiration with these because they're highly volatile. You would probably have to drink a lot of acetone to get ketotic, but in generally it's not like toxic alcohols where you have to dialyze them or give them fomepizole. It's just tincture of time and wait it out, and the acetone will go away. This type of acetone will not get picked up by getting a beta hydroxybutyrate lab, which checks for beta hydroxybutyrate, of course, rather than acetone, which is a slightly different product. Nail polish removers contain mixtures of acetone and alcohol, so again, think about that once more. There was a very notorious false nail, so these were the glue-on nail, that in order to take the glue-on nails off, you needed a false nail remover. The name of the product was Super Nail Off, so I don't think they would give you that, but they may say a false plastic nail remover. It was an acrylic cyanogen, and it was slowly metabolized to cyanide. And when the kids drank even small amounts of it, they died of cyanide poisoning. That product is 30 years off the market. I don't think it's going to come back. I don't think anyone's going to use those products anymore. Will they ask sort of someone found a bottle of false nail remover in the attic kind of question? Can't say for sure, but I guess that's a possibility. Obviously, they would get treated with a full bore cyanide antidote kit that we talk about, resuscitation, intubation, oxygenation, and probably even bicarb for their acidosis. Stuff for teeth, in generally, most of the stuff is low toxicity. Uh, Fluoride content varies. Usually it's low strength. I mean, you would have to eat an entire tube of fluoride to get any sort of fluorosis. Kids who eat a whole bottle of their sodium fluoride tablets, I guess, might get sent in to just get some calcium levels checked to make sure the fluoride isn't binding with calcium. But in general, it's pretty hard to get there because fluoride's irritating to the stomach. It kind of creates this soapy, sort of nauseating, flurry, slurry down there. And most kids will vomit all this up. There are super strength fluoride content toothpaste, which in the US is available only by prescription, though you can go up to Canada and get them over the counter. So people do that sometimes. Again, you'd have to swallow like a half a tube of a standard size toothpaste tube to get anywhere near the fluoride content to be ill. Most mouthwashes are generally safe if you drink a swallow while a kid's trying to use it, or an adult may have ingested it with the intent of self-harm or getting intoxicated because of the alcohol content. I think you could do some simple math, figure out what the alcohol content is, which usually has the order of 5 or 10%, how much they drank volume-wise, what their weight is, and kind of predict what their blood alcohol concentration may be. If the intent was injurious, self-harm, they should probably get sent in to see what else they may have done and to be counseled, of course. Things that clean dentures in general are irritating, but not super toxic. They contain borate, so boric acid, phosphates, which may phosphoric acid with low concentrations, and then bicarbonate to kind of neutralize them. So they're usually not high or low, super low pHs. I guess if you drank a whole slurry of denture soaking dentifrice solution, it could be pretty irritating. I would say give them the usual, see if they can swallow in 30 minutes, simple water, and if not, then you might want to send them in. I think it would be extremely unusual, except in a purposeful large ingestion, to cause any sort of esophageal injury with these products. Here's a little bit more on fluoride. How much is in toothpaste? 5 milligrams per teaspoon. So 1 milligram per mil is 100 parts per million. They can get hypoglycemic if they're hypocalcemic, and maybe some signs of weakness if they're upwards of 5 to 10 milligrams. So even though they often say a teaspoon is enough, I think that's probably pretty rare. 10-kilo child would need to take 10 teaspoons to get up to 50, which is what a 10-kilo child would need in the milligram per kilogram size. So that's a lot. I mean, it really is a lot. Prescription strength toothpaste, as we mentioned, available by prescription in Canada, can be stronger. Water fluoridation, you can see is lower amounts. Fluoride gels for gel treatments can be as high as the prescription toothpaste. So I would worry if someone had some sort of fluoride gel that they had a prescription for like, some sort of teeth treatment, probably 5 milligrams per mil. You can do the calculation and send them in if it's above 50 milligrams total. I think they like doing fluoride math on these tests for some reason. Let's switch gears a little bit to hydrocarbons. Going back to chemistry, there are aliphatic, which are chains of carbons and hydrogens. There are substituted aliphatic chains, like halogenated chains that have chloride, fluoride, and bromide attached to them. And then depending on the bond between the carbons, it could be an alkane with a single bond, an alkene with a double bond, and an alkyne with a triple bond between carbons. And the longer they get, the less likely they are to be gases or liquids. And once you get up around a length of about 12 carbons, they're usually waxes, pastes, and paraffins, and harder to swallow. Those are the aliphatic. Those can cause problems through inhalation and also aspiration. The aromatic are ones that have a ring, a six-sided phenol ring or benzene ring. Benzene has a high risk of malignancy and aplastic anemia. Toluene is actually used extensively as a diluent for dozens and dozens of products, including pesticides and other things. It has a very strong odor, so it is indeed aromatic, as are all of these substances. And then phenol is the alcohol of the aromatic ring, so it's got an OH group on the end. It can be degraded into benzene, so small risk of long-term use of phenol with malignancy, but in general, if you get it on your hands, it sort of turns yellowish colored, which is not dangerous, but just needs to be wiped off. So most of the skin exposures, wash it off. Most of the did I drink it exposures has to be with worse there, choking, aspiration due to the high volatility of these hydrocarbons. And most of those, if they're not having pulmonary symptoms, can be watched at home. There are some that have systemic toxicity, and if you are using them over and over again by inhaling them to get high, they work the same way as inhalation anesthesia. The regular straight chain ones, the ethane, propane, isoflurane, octane, those can certainly produce altered mental status. But the hydrocarbon ones, the ones with lots of halides on them, sensitize the heart to catecholamines. So if you have a sudden anxious or startle response, catecholamines are released, adrenaline is released, the heart can have a sudden arrhythmia. And that's what we call the 6 steps and die syndrome, which we mentioned yesterday. This tends to be a younger children, middle school problem. All sorts of things have been used over the years, going back to model airplane glue in the 50s, to typewriter ribbons in the 60s, to dry cleaning fluid and spot removers in the 70s, to computer dusters, which has DFE, difluoroethane, in it in the 80s and 90s, and other things like air fresheners and refrigerants and dry cleaning things. So you have to look up what the product is, but all of the chloral, fluoro, bromo ones I worry a lot about sudden sniffing death, and probably ought to watch those people who've been huffing for in a hospital environment with an IV on a cardiac monitor for an extended period of time, maybe 4 hours, 6 hours, and then until they're completely not anesthetized or not stuporous, and then they could possibly go home. Petroleum products, gasoline, kerosene, tiki oil lamp, which you see pictured here. The first bottle is Wesson oil. Next is tiki torch lamp. The next one's apple juice. The next one's tiki torch oil. These all have non-child protective screw caps. They all look identical in sort of the same yellow amberish color to each other. And they're often, especially in the summertime when it's tiki lamp season, mistaken and poured into a glass and someone drinks these. They are highly volatile substances. The risk here is not so much to the GI tract, but the aspiration caused by just the substance in the back of your mouth, but often vomiting and regurgitating the substance up and re-inhaling the fumes. So these folks who drink this usually have to be watched. I think they have to have a pulse ox. I think someone has to actually listen to their lungs to see if they're wheezing. Usually the recommendation is for about 6 hours. If after 6 hours there's no wheezing and no pulse ox and no struggling to breathe, and at that point a chest x-ray shows no evidence of an infiltrate, they possibly can go home. If the x-ray shows some kind of infiltrate, it's probably prudent to watch them longer. Usually, if they develop a progressive ARDS or pulmonary acute lung injury, it'll happen slowly, but sometimes it just happens in the middle of the night when people are sleeping and no one's watching them. So I still think the standard of care, the answer on a test is if there's something on x-ray, they get watched at least 24 hours. Hydrocarbon, if you're inhaling it, you can get CNS depression up to seizures and coma. You can get coughing and wheezing and gasping, asthma-like symptoms, and then looking for changes on the x-ray, of course, like we talked about. Most dermal exposures can just get rinsed off if they drank it. We just talked about do not induce emesis. Do not, you can try to rinse out their mouth gently with a tiny swig of water to get that cleared. But it's basically standard care, 6 hours, exams, pulse ox, chest x-ray, and oxygen if their pulse ox falls. There's a couple of unique hydrocarbons that are worth mentioning. This is probably the biggest one we hear about. Methylene chloride, which is pictured there. It's a one carbon with two chlorides and two hydrogens, so a very simple structure. Um, is often used in aircraft removers. So people don't usually have an aircraft in their garage that they're cleaning up on a Sunday, but they tend to use the same product to clean a lot of other hard, gunky things that you really want to solve a strong solvent. And this has been repurposed to bathtub refinishing, getting all that gunk and moss and mildew out of your tile of your bathtub. Unfortunately, when you're using it in a small enclosed space, and this is slowly metabolized over 4 to 6 hours to carbon monoxide. We've had cases of people working all day long in a closed space bathtub with methylene chloride, suddenly becoming obtunded, passing out, even having a cardiac arrest, and they have carbon monoxide levels that are substantial. I think you have to treat it with high flow oxygen. I think part of it is their CNS is going to be affected due to the hydrocarbon element of this, so it's always hard to sell these to hyperbaric chambers. But I guess if they were resuscitated and still obtunded on oxygen and the carbon monoxide level is above 30, I would try to get into a hyperbaric chamber because they're still going to make carbon monoxide in a significant amount until they clear the metabolism of the methylene chloride. What about things in the kitchen? Kitchen smoke. Well, Most oils and stuff are just that, it's just burning oils. But if you burn Teflon, you can get polymer fume fever, which can lead to a significant pulmonary injury. There's less Teflon around than there used to be. These sort of coated rubberized pans are sort of falling out of fashion, and there's new ones with new chemicals on it, I presume, that we'll probably find problems with down the road. A lot of them have metals in it, and there's risk of overuse of some of those with metal toxicity. But if someone's got cough or fever or dyspnea after burning something on this kitchen pot or pan, then they should get sent in, should get a chest X-ray, perhaps a chest CT if they have pulmonary findings. They probably should just be monitored, given high flow oxygen until it resolves. Most of these resolve on their own, but they obviously need oxygen if their pulse oxes or blood gases show hypoxemia. Mentioned mothballs yesterday. It's another household product, comes up under pesticides and mothballs both. But basically, my trick of remembering these is alphabetical order. The earlier in the alphabet, the more toxic. Camphor, not around very much, can cause seizures. High dose camphor ingestions get a 911 call because they can seize within 15, 20 minutes. Naphthalene can cause methemoglobinemia, so N and M sort of go together there. And then the newest one's paradichlorobenzene, not particularly toxic, but it is radiopaque. So if you get a mothball and you want to find out, is it this versus that, you can put it on an X-ray plate and just take an X-ray like you were X-raying someone's hand, and it should show up as a dense, round, white object, whereas camphor shouldn't. It used to be in products like athlete's foot preparations, like camphorphenique. It's derived from the bark of the camphor tree and terpene oil. It's was used. Camphorphenique was at 10.8%, and that was sort of our threshold. If someone drank camphorphenique, 10.8% camphor, they went in. If it was less concentrated than that, they were okay to watch at home, make sure they didn't have a seizure. Any two swallows was usually the triage thing. Mortality is upwards of 5 cc's, so it doesn't take much. Usually there's a sensation of warmth, epigastric burning, nausea and vomiting, headache, confusion, progressing to restlessness, twitching, and then seizing. These are our guidelines, I believe, but they pretty much go along with general guidelines. A teaspoon of 20% camphorated oil gets 911 call. 2 teaspoons of camphophenique, which is about 11%, gets a 911 call. Seizures can happen very quickly. Asymptomatic toddlers, once they get to the hospital, can be watched up 4 hours is a good round number to watch them. And of course, seizing should be treated the usual way with IV benzos, Ativan, or Valium. Other things around the house, e-cigarettes, these enhanced nicotine delivery systems. The concentration in the commercial products of nicotine is extremely variable. It's not really well regulated. I know recently Oregon has pulled all the flavored ones off the market, so that's a good thing locally, but still the stuff is out there. People pick this stuff up while they're traveling to other places. And the size of the bottles, the concentration of nicotine, and the easy dropper cap that someone might easily leave a jar and a child can get into make them a bit of a risk. This is how much nicotine is in a variety of products. A single cigarette has maybe 30 milligrams. A nicotine lozenge has a couple of milligrams. Nicotine gum, similarly. But the liquid is variable. It can be upwards of 50 to 100 milligrams for a small amount to fill the chamber of a vaping device. We had one instance that Matt Noble was on when he was a fellow, wrote up. They took the concentrated nicotine and diluted it down to their own smokable version. They needed a bottle to put it in, and hey, there was an empty bottle of children's Tylenol laying about. So they used that and stuck it in the fridge. And then one day, the kid had a fever, and the parent who didn't know that that was done used it and gave the kid a whole bunch of nicotine they didn't see written very lightly in blue letters in the back, NIC, which I wouldn't know what that meant. It could bet this is for the child named Nick, but it wasn't, and he got obtunded and quite sick and was in the ICU for a few days. So still is around and problematic. Nicotine, sort of the mnemonic to remember, nicotine exposure is early on, they usually just get nausea, vomiting, and salivation. So it kind of looks like, oh, it's like an organophosphate poisoning. And later on, they get this Monday, Tuesday, Wednesday, Thursday, Friday sort of fasciculations, weakness, tachycardia, dilated pupils. But later on, they can get even profoundly ill with hypotension, bradycardia, and go into shock. This probably only happens with people drinking the liquid pesticide versions of nicotine, which are not generally available anymore. There used to be a black flag nicotine product that people could drink, or not drink, but spray to kill their pests, and accidentally drank it by mistake. And it would go pretty quickly to this late onset, profoundly ill person. But in general, kids will get nausea, vomiting, tachycardia. I think the child that uh, Matt Noble saw had some vital sign abnormalities. I think he also had some seizures too. So if you get enough of it, you can get sick. So I have a bunch of miscellaneous associations with other things out there. So you might, if you see one of these on a test, realize what they're really talking about. Oil of wintergreen is methyl salicylate, so you need to get a salicylate concentration. Vanilla extract often is 30 to 35% alcohol, and so you can get quite intoxicated if a child would drink that. Pennyroyal oil, used for a variety of things, but occasionally as an abortifacient, may be rising in states where access to abortion has now been curtailed by laws. This may be coming back as as a herbal version to do it, but unfortunately it causes liver failure. The treatment option for this is to use IV NAC in the same doses that we use for Tylenol toxicity. Licorice, real licorice, the black licorice you can buy overseas more than here, not the red strings you can buy in the most candy stores. That has glycosuric acid in it. It's an aldosterone-like substance and produces hypokalemia. Treatment is just replace the potassium. Those folks usually get moderate hypokalemia, potassiums of 2.5 to 3. If you see someone has potassium below 2 or in the ones, the thing you should think of is barium from certain types of fireworks, like snake fireworks. We had a case of this presented at the last Washington Poison Center conference that we have every other Monday. Someone had eaten these black snakes that you light on the ground and they kind of expand from there, and they had profound hypokalemia. And I mentioned bromates earlier, but bromates is a thing that causes hearing loss, which is kind of an unusual thing uh, to present for toxicity. But in these cold waves, hair straightening solutions is what you should think of if you presented with a case involve that. You can actually get a bromide level from regional specialty labs to kind of sort that out. Vitamins, usually all the water-soluble vitamins are pretty benign. The fat-soluble vitamins A and D and E are generally benign. I'll mention A, you can get a hypervitaminosis A from eating these super concentrated vitamin A products like the old days cod liver oil or shark liver oil. People who are in the Arctic and have to eat polar bear liver classically get hypervitaminosis A with intracranial hypertension, headaches, nausea, vomiting, altered mental status, delirium, and papilledema on exam. So they might give you a case where somebody was eating an old healthcare product in a house that had been there for decades, and they presented with headaches. What findings might you find on exam? You might say, look in their eyes for papilledema, look for intracranial hypertension on a lumbar puncture. They would have elevated pressures, opening pressures. The other vitamins, I mean, you have to take a lot of vitamin D to get hypercalcemic, and it's probably unlikely, except if you use one of those pesticides we talked about yesterday. E and K are generally not problematic. Other word associations, though, with a few of these, niacin, which is a B vitamin, may cause flushing. They may be treated with single doses of aspirin. vitamin D, hypercalcemia, and of course, vitamin B6 we mentioned is the antidote for INH and also for methyl MMH, mushroom toxicity, but in and of itself has low risk of toxicity itself. I like this product, no flush niacin. I think it had some sort of long chain niacin product in it that doesn't get released immediately. Foreign bodies. Let's start with the bad ones. Um, these super magnets that were so popular like 4 or 5 years ago kind of went away for a while, but sort of are coming back. And certainly you can get on the internet and go to Amazon or any other seller and get these. These are all made out of the rare earth metal neodymium, and they're super strong. Now you can put these magnets like literally a foot apart on the table and they would just move back together again. And they do that if you swallow two of them in your stomach. If you swallow one of them, as long as there's no other metal around, you're okay. So it's two or more are the problem. And here's what happens. They get separated as they travel through your GI tract, and a couple of magnets here and one magnet there may pull together, compressing loops of bowel in between, creating pressure necrosis on the bowel wall and a closed loop of bowel, and they can have run the risk of perforation or obstruction. And so more than one, the goal is to get them early while they're still in the stomach and they're able to be gotten by endoscopy as soon as possible. Once they're moved, they're past the first curve into the duodenum. You just got to watch them real closely, and any sign of um, GI distress, distension, vomiting, lack of bowel movements, follow them for several days until they pass the magnets. Um, they may need surgical retrieval. So we have to tell people it's not just go home, we'll see how you're doing. They have to be right on top of them that any signs of symptoms, they go back to the hospital, get repeat x-rays, and see if they are in the stomach. Needless to say, these people cannot get MRIs. Those are magnets. They will be attracted to an MRI scan. Here's some pictures. Here's a ringlet of them in the stomach altogether. That would be definitely something I would get out because they can separate as they travel. Here's the side picture showing they're all together. Here's just two of them, but they can be problematic enough. You can see perhaps look some early bowel obstructive picture with a lot of gas backed up behind it. Here's a picture of what it looked like on endoscopy. The other bad actor is button batteries. These don't go down as far because they're usually big. It's usually the 3-volt lithium battery that's used in so many little handheld devices that we worry about. They start burning immediately. And we should tell them first aid at home is to take a teaspoon of honey every 10 to 15 minutes to put a coating around it so the burning is lessened. It's not completely removed, but it's lessened by the honey. And once they get to the hospital, they can either continue to use honey or they can use the GI coating agent sucralfate to coat their GI tract. But if it's in the esophagus, it should be removed. So they should get an emergent x-ray. Ideally, I would say locally, they should be triaged no matter how far away they are. I would say within 50 miles to one of the pediatric hospitals, Randall or Dornbecker, because this really needs to happen quickly. It shows you the difference between a coin and a button battery is this lip. I don't know if they'll show you an x-ray or something like that, but they may describe this as this lip that button batteries have, whereas a coin does not have that. And on x-ray, usually a swallowed round object will face you because it gets stuck in the esophagus. If it's not facing you, if it's on its end, it could be stuck in the upper airway, like going right through the vocal cords. Those are worrisome for risk of sudden choking and unable to breathe. But if you see this on x-ray, they need to be scoped. Other than the honey and the sucralfate, they should be MPO and get as quickly as they can to a pediatric GI thing. We've done this experiment with hot dogs multiple times. Some of the newer versions out there have a little plastic thing on it. So we wanted to know, would the current still burn through the little plastic shield, the warning label? And in fact, it does. So we put a button battery inside a hot dog, and this is one I think that had the button battery, and this is new and old battery. They both burn. So even after they don't work anymore, This is after 15 minutes inside of a hot dog. This is presumptively what it's doing inside your esophagus. It's causing this burn right around the edge. It's not from leaking contents, it's from the electrical current that's generated. And emergent endoscopy removal. This is a critical, must be done as quickly as possible event, middle of the night event, if need be. Other metals that sometimes come up from time to time. Cobalt used to be in chemistry sets. It was once used as an additive in certain beers that to give it more of a foamy head and produces a cardiomyopathy. It's sometimes in hips that are metal hips, a cobalt. Those are the three places you get cobalt. Those all things can cause a cardiomyopathy. Acutely, it may just cause a caustic injury to a child if he ate one of these old-fashioned chemistry set ones. We mentioned gun bluing is selenium acid, very bad, multi-organ system failure. Similar to Teflon polymer fume fever, there's a metal fume fever, mostly from soldering, which is mostly zinc, although other metals are capable of doing it. If someone's working very closely and doing some soldering work, they can inhale the fumes. They usually tolerate that for hours, and only later in the day, usually after work in the middle of the night, they wake up with a cough or dyspnea or wheezing. You get a chest x-ray and it's got multiple infiltrates. This is not a bacterial or viral pneumonia that needs antibiotics. This is a chemical reaction. It will usually get better over days, but they usually need to be hospitalized for supplemental oxygen. Sodium toxicity, we've seen all sorts of weird challenges and people doing silly things. And of course, the internet has made all of these things worse and dumber. Drinking bouillon cubes, soy sauce, baking soda, all these challenges up there. If you take enough salt, you'll become hypernatremic to the point where you may seize and black out and have significant problems. If you're hypernatremic, the answer is you need to give them free water, D5W, which is essentially free water with glucose, to dilute it down. It should probably be calculated to come down slowly over about 24 hours. And finally, they always ask about some pet care products in general. There aren't too many that cause problems. We see in aquariums, we have seen several cases of coral being washed or cleaned, and they release palliatoxin and develop pulmonary symptoms as it off gases off the coral. And again, these usually be monitored, pulse ox done, get a chest x-ray. Another favorite question, although it's really not much of an issue, is in fish farming, they use malachite green. It's got a long-term liver injury, perhaps carcinogenic. If you eat fish that were fish farmed where they were treated with malachite green, that may be a problem for liver injury, but I think this is more of a theoretical thing than a real thing. Ivermectin's been in the news ever since COVID, but we use it for heartworms in dogs. It can cause CNS symptoms if you take enough of it. There's other vectums out there. There's a moxidectin that's used for horses that we recently had somebody eat a lot of and was altered for like 5 days. So if they're altered after eating these, then they need to go in and get observed. If they're not, we can call them back in an hour or two and see if they're still pretty lucid. We talked about some of the pesticides yesterday. Most flea and tick powders have pyrethrins, which is from the chrysanthemum, which is low secondary toxicity. There's one flea pill that you can eat that causes seizures in dogs. I don't think there's any risk to humans causes seizures because of the amount of the doses in it. Obviously, you don't want dogs to have seizures, so they dose it very, very low. And the other thing we sometimes see is people taking their pets on an airplane, although now you can take them inside the cabin, but when you used to have to put them in cargo, they used to give them a dose of acepromazine to tranquilize them. It's an antipsychotic. It's very similar to Thorazine. Kind of knocks the dog or cat out for the entire trip. Sometimes you see if dogs are nervous. So these are some of the pet care products that we worry about. And there's our number. So let me go back to stop sharing, and someone wrote some more things. So 1 ml of 3% hydrogen peroxide reduces 10 cc's of oxygen at standard temperature. So 60 cc's of 35% produce 6 liters. So that's a pretty good conversion right there. I think the one that would, so that with 2 tablespoons or whatever was the one that produced 12 liters that Mike had calculated out. Lots and lots. There's probably one or two little other household products that are listed in the full curriculum. I guess they can ask questions on. Most of them I looked over were not particularly toxic or anything unique to do about them. But sort of a lot of these questions tend to be triage questions, like who needs to go in and who does not need to go in if a child accidentally got into these. And so that's probably the important things to know. And then the few buzzwords of risks of which one produces caustic injury, which ones produce CNS problems or seizures, which ones need other unique antidotes like methylene chloride might need hyperbaric oxygen if they're obtunded enough. And barium may need potassium. Barium worms worse if ate pre-burn than post-burn. Yes, I think that's true. The kids eat because they're easy to eat pre-burn because they're tiny little round tablets, look like a big black Alka-Seltzer tablet. And you just swallow the whole thing, and it's chewy and soft and friable, and the whole thing can get ingested. All right. Any other questions or anyone thinks of anything else, just shoot me an email or something and I'll answer them later. We'll be back after lunch to cover a whole variety of things, metals, some of the more unique metals, food poisoning, bites, stings, snakes, and spiders for the end of the day. So back at 1, everybody. We'll see you then.